priming an IV infusion. So first, I'm gonna perform hand hygiene. I'm gonna introduce myself to my patient. Hi, my name is Nadine Walters. I'm a third semester George Brown student, and today I'm gonna be doing an IV infusion for hydration. Is that okay with you? My client said yes. So there's two identifiers. So I identify the name, her date of birth. So I have to verify. Then I wanna check the doctor's order. So I check the MAR with the doctor's order, and then I check for the flow rate, the type of infusion, and the amount that I'm gonna be infusing. After that, then I check the 10 rights. Then I inspect the bag for any sediment, any leakage, any cloudiness. Then we check the expiry date, which is in the top right hand corner, and it's not expired until 2020, so we're okay. Then we're gonna put the IV on the pole, and then we're gonna open the tubing, the IV tubing. Then we're gonna roll the clamp. So this is to stop the IV flow rate. So when you put it down, so it goes up and down. So when you go up, it stops, and when it goes down, it increases it. We also use the blue one as well, the blue port as well. But if there's an emergency situation, you need to stop it right away. You just press it like that, and then you can open it back. So then we're gonna roll the clamp close to about 2 to 5 centimeters. And then we have to, before we spike the bag, we have to close the clamp. So after you do that, then we're gonna spike the bag. So this part we have to maintain a sterile, aseptic sterile technique. So we don't want to touch here, because once we put it in the patient, once we put it in the bag, this is where we don't want any germs, because we don't want anything to get into the patient vein. So we open it, and if we have a alcohol sub, we can wipe here as well. And we pinch it so there's no liquid coming out. Oops. And then we twist it. My bag is a bit loose, so that's why the water was coming out. But in a normal situation, when you turn it upside down, it shouldn't be coming out. And then we want to make sure there's liquid in the chamber, so we squeeze it to 2/3 to a half. So we squeeze it. And we all want to make sure that this is closed as well. So there's enough water here. So now we're gonna prime it. So before we prime it, we have to make sure that the port is inverted. So we turn it this way because we don't want any air bubbles to come in the tubing. So we can go ahead and do it. So we can slowly move the roller up. So this is like regulating the drip rate. Depends on how much drip per minute, and then you can just slowly close it off. And you want to make sure that there's no air coming out. Yeah. So I see that I have a lot of air bubbles here. So we can flick on it. So we can flick on it and make sure that you invert it as well. So there's a lot. So you can pull on it, or you can just open the top and just run it right through, because we don't want any air in the tubing. So we can just have it run all the way through, just to make sure there's no air. Once all the air bubble is gone, we close the clamp. And I've used the alcohol swab, wipe the top part of the port, and then to maintain a sterile feel, and close it back, because this has to be inserted in the patient arm, in the IV.